And welcome back to the WHHI Daily News. This is the most dangerous time of the year for your heart, according to Dr. Tywaun Tillman at Orlando Health. So it's great to have you with us, sir. Why is it such a dangerous time?
Well, the holidays, they're a wonderful time, a very festive time, but it can cause danger for your heart. And one of those things that we often see during the holidays is something called holiday heart syndrome. And what that is, it's a sudden onset of an abnormal heart rhythm called atrial fibrillation. And it's typically brought about by excessive alcohol intake during short periods of time over the holidays. Often occurs on weekends and vacations as well, but it's something that we see a lot of. In addition to holiday heart syndrome, we also see an increase of cardiac-related hospitalizations and deaths, for example, heart attacks and stroke. And that's all due to a lot of the things that go on during the holidays. So if you think about what you do during the holidays, a lot of times there's travel, which disturbs sleep patterns. There's lots of interaction with family members and lots of people together. That can increase the likelihood of other illnesses and causes stress. There's things that you eat that you don't normally eat. I know you're in South Carolina, and so everything has either Old Bay or Lowry seasoning salt. And so salty foods can increase blood pressure and put stress on your heart as well. And then finally, as I mentioned earlier, there's typically a lot more alcohol intake than you normally would use, during your daily life. So those are all things that add together to increase stress on your heart, and it can cause holiday heart syndrome or even more serious problems like heart attacks, and death rates increase as well.
Right, and so I'm reading this statistic, cardiac emergencies surge between Thanksgiving and Christmas by 40%. And you've given us the reasons why: the stress, the overindulgence, not eating and drinking in moderation, the travel, the sleep disruption. So I guess the most important part of this interview is, so what should we be doing, Dr. Tillman, to reduce our stress and reduce the opportunity for us to hurt our hearts?
Well, you mentioned stress, and that's one of the things when you think about the holidays that I didn't mention is the shopping and the constant going. And so, you think about, you schedule time to visit, you schedule time to shop, you schedule time to do all these other things. You should also schedule some time in to relax, some time to de-stress. And so that's an important part of it as well, because emotional stress also leads to physical stress, which can also lead to all of these issues that you can have with your heart. In addition to that, we talked about excessive alcohol intake. We talked about the sleep disturbances, and we also talked about, the eating. So let's start with the alcohol intake.
Okay.
That's something that can come from both sides: the individual that has responsibility of taking care of themselves and the person that's planning the event. As an individual, you want to make sure that, you pace yourself for your drinking. You want to make sure that you're mixing, and when you're drinking, in between alcoholic drinks, you may want to drink a glass of water or another non-alcoholic beverage. And you also may want to eat before you start drinking. Those are all things that can minimize the risk that you're going to drink too much and minimize the risk of any adverse effects from your alcohol consumption.
Right.
When it comes to
good advice. Just go ahead.
When it comes to eating, we talked about salty foods. That's really the biggest culprit when it comes to stress on your heart and cardiovascular events associated with holidays. For eating is salty foods. So as a host, you want to make sure that there are healthy options, low sodium options for your guest. You want there to be some items that are not processed, healthy vegetables and so forth that they can eat. And they're going to eat whatever you serve them. So if you serve them healthy options, they're more likely to do that. And then lastly, we talk about rest and disturbances and all those things. When you're traveling, you may miss medication doses just because your schedule is different. You may sleep differently, stay up later, sleep less. Those are also all things that can cause stress on your heart. So try and adhere to your normal schedule as far as getting adequate sleep, getting adequate rest, and of course, finding some time to de-stress yourself.
Thank you so much, Dr. Tywaun Tillman. Great tips. You are a cardiologist in Orlando Health, and we just appreciate you Zooming with us today to give us this great information. And we will take it to heed. We promise.
Celebrate smart.
Yes, celebrate smart. I love it. Thank you, sir, and happy holidays to you. And that's a wrap for this edition of the WHHI Daily News. I'm Robyn Zimmerman. Thank you all so much for watching. I want to thank the team behind the scenes who make this newscast possible. Stay safe and healthy, and we'll see you next time.